Hi, listeners. Thank you once again for tuning in and joining us for the next Lessons from the Playroom topic. Today, we are going to be covering one of the most requested topics over the last year, and I've been waiting and waiting for the perfect person to show up to be able to support us. And I am incredibly honored and excited that today we have Dr. Montserrat Casado here to educate us about PANS and PANDAS. I know that there's a lot of questions. Maybe you're familiar with the terms, maybe you're not familiar with the terms. So please grab something to write with. My guess is you're going to want to take some notes. So before we get going, let me go ahead and introduce our guest. There are some things I'd love for you to know about her. So she has been training for over 17 years, school counselors, mental health counselors, play therapists, a marriage and family therapist. She loves working with kids and families. She's a licensed marriage and family therapist, registered play therapist as well. She has a specialization on focusing on resiliency, attachment, and trauma. And for today, we're going to be focusing on PANS and PANDAS. She is EMDR trained, ART trained, TBRI trained, and also trained in adoption competency. She's written many publications over the years. As an educator, she's done many workshops over the years, helping families and clinicians understand children through a holistic, trauma-focused, and strength-based approach. Thank you so much for bringing your expertise into our conversation today, Montse. I'm just honored you're here.
A pleasure to be here with you, Lisa. Appreciate your invite and the opportunity to talk to you.
Yeah. Well, let's dive in. And the first question I want to ask is, why is this such a important topic for you? Why are you educating people on it?
I think it's a twofold answer. One is the fact that I am very much aware that I'm an educator. My goal throughout my whole career has truly been training play therapist. When I joined my first university job, I was tasked with the idea of creating the first play therapy certificate that we had in Florida at the time, because I couldn't understand why I went through my whole EDS and PhD and they didn't have a package program. So I thought, oh, the next load of students will have it easy to follow the assigned classes that they require, and it will be done. So educating play therapists has always been at the top of my list. But then at the end of my teaching years, by then I was a mother to my child who will turn 13 tomorrow. And I realized that there were things going on with my child that were not the norm, but she had a history of trauma, and there were a lot of sensory issues that we diagnosed when she was 2. We knew that she had some developmental markers she hadn't met at the appropriate time. So we knew there was things in the background, but I kept thinking something doesn't make sense, and I didn't really know what that was. And it was by me working with somebody else, actually not my own kid, that I started digging more to figure out this other child had a lot of the same issues that I have gone through with my kid. And I started discovering this new terminology of PANS and PANDAS. And at the time, I didn't know what it really meant. But being a mom, so I'll fast forward to, she was 2 when she was diagnosed with sensory processing disorder. It was not probably until 6 years later that I started thinking that there is a new diagnosis here. And I'm not really big on diagnosis, but just to understand what she was going through, that I don't know what it is. And at that point, I had learned so much about PANS and PANDAS that I really realized, okay, she truly has PANS, because by then she had been diagnosed with mold toxicity and also Lyme disease. And as I have uncovered more throughout the years, those are 2 critical pieces many times that children with PANS and PANDAS have. So I'll talk more a little bit about that. But as a mother, I have felt invisible. I have felt lost. I have felt like going to medical providers was confusing, to say the least, if not being seen as, well, you're not parenting her right, or she needs some intense psychiatric treatment. And if you provide that, that will take care of these issues, which I don't believe that's necessarily the answer. And many others who specialize in PANS and PANDAS don't believe that's the answer. So it was my own pain and my own frustrations that I realized if I can only do so much as a provider, as a clinician myself, but certainly as an educator, I can educate other play therapists that no child that walks through their office, if they indeed have PANS and PANDAS, that the therapist won't be able to know what this is and will be able to hook them up with resources. So that's been my mission for, I was still actually in Colorado when I started this. So it's been at least 8 years that I've been trying to put my footprint in the field in terms of helping other therapists understand what PANS and PANDAS is.
Thank you for sharing your story, and thank you for sharing with us what you've learned from your journey. And thank you to your daughter for
Yes.
being a catalyst for all of us now today in this conversation. So,
Yeah.
yeah.
And I wanted to share a little piece that she shared with me this morning, because I asked her, I said, is there something you would like to share that would be helpful for others to know about this condition? She says, yes. I would like them to know that as a child, I feel like somebody traps me in my body, and I'm there watching an incredible amount of things that I don't feel good about. I don't feel proud afterwards, but during the time I can do nothing. I'm like trapped, and I can't do anything other than lash out, whether it's verbally or physically, and I have no control over myself. So that I need others to understand that piece.
Well, her voice is heard. So
Yeah,
thank you for bringing her into this.
yeah.
So let's just start from the top, because some people may not, maybe they've never heard of PANS or PANDAS, or if they have, maybe there's just a lot of confusion about it. Can we just start, like, what is it? Let's just start there.
Sure. Most people have heard PANDAS. However, the major diagnosis is actually PANS. And that's the big umbrella. PANDAS falls under the PANS. So, and there's been changes in our field since this diagnosis came out. At first, where they really looked at this as a pediatric diagnosis. So PANS stands for Pediatric Acute-onset Neuropsychiatric Syndrome, although there is debate about the acute onset. So I still go back to calling it pediatric autoimmune neuropsychiatric syndrome, because there is an autoimmune component, and it's very important that we all understand that. And I can explain that a little bit more in a minute. But for some kids, again, and this is why it was referred as acute onset, for some kids, it was something that happened that overnight their child changed drastically. I'm talking what many others refer to as the beauty and the beast. My child was normal, they got sick, or they were exposed to something, or they had enough toxicity in their bodies impacting their brain that they went to bed being one way, and they woke up and it's like this child that you don't recognize, from loss of speech, developmental task regression, behaviorally, psychiatrically, you name it. So that's the big diagnosis. PANDAS, which is the one that most people know, is pediatric autoimmune neuropsychiatric syndrome, which is associated with strep. So you can imagine how many kids we have that have been exposed to strep. Particularly, strep is extremely common in schools, or families that have been exposed to strep. So normally these are the kids that will have sometimes one incident with strep, sometimes recurrent strep infections, and that strep infection triggers the PANDAS diagnosis. One thing that I think it's important for all of us to understand is that it's never just one thing. And I think we all know that as therapists, that it's never, oh, the parents are going through a divorce, therefore the child is struggling. There's always a multitude of issues that are going on. And in this case, I think it's never just one. It's never, my child was exposed to mold in a very moldy school at the bottom of Boulder Mountains. No, that was not just the issue. There were other issues impacting her illness, because she also had the Lyme disease, and she also had a genetic inability to do detox. So there were other issues. So it's always a combination of several issues that are impacting the illness. However, when you think of strep is here in your throat, and here behind you have your brain.
Yeah.
So of course, the strep is going to cause brain inflammation. And I think one important piece, regardless of what's underneath the iceberg, which I call, we have this iceberg that we see these neuropsychiatric behaviors, symptoms that the child is displaying, or academic regression or developmental regression, but we also have, we always have brain inflammation.
Yeah.
And you are very focused on brain health in your approach. And when we think of the brain, the piece that we also need to think about is we need to think of the gut.
Exactly.
80 to 90% of our serotonin is made in our gut.
Yeah.
So if our gut isn't okay, neither is our brain. So the brain-gut connection axis that many times is not working properly with these kids. But certainly inflammation, brain inflammation, we need to think of that if nothing else.
Yep. And just thank you for even just dropping that little piece in, because that the piece around gut health is not something that we hear a lot about in the play therapy world. We don't hear it talked a lot about in terms of its relationship with mental health symptoms. And so just thank you for just dropping that in, because it is a significant piece of the puzzle, in my opinion, anyway. It's huge. It's huge.
It's huge. And this is one of my new campaigns along Sideways with Pans and Pandas.
Yeah.
Looking at the gut, but also my metaphor, because I use a lot of metaphors as a play therapist, is we need to look under the hood of people's brains, which means when people come to therapy, if they are depressed, if they're anxious, if they have OCD, we need to really if we have a vehicle and we take it to the mechanic, they always lift the hood and they look to see how's the motor functioning, how are the valves, how are the oils, the other, I'm not a mechanic, but the other fluids that go with the vehicle. And then they tell you, okay, this needs to be repaired, this needs to be added on, and they do it. But in therapy, and psychiatrists, actually good psychiatrists talk about this, we don't do that in mental health. I mean, we look at symptoms and then we give them a label, but we really don't understand why does the person have this symptom. And I'm going to give you an example, actually, coming out of my own child, for instance. I'm going to talk about, for instance, one element only, which is B12. B12 plays a critical role with depression, anxiety, hallucinations, delusions, mood disorders. Nobody comes and looks at our clients' B12 levels. I mean, we don't have the ability to do it because we're therapists, but rarely, if we send them to a physician, rarely will they check the B12 unless the physician is very much in tune with what are from a nutritional perspective, what are the vitamins that impact mental health, like vitamin D, B12, all the other Bs, zinc levels, all of those that really affect mental health, which again, it really goes back to the gut. If your gut is not working right, you're not going to have a solid, healthy nutritional values in your system, and all of those will impact your mental health. I think this is where I feel like our profession is going to start shifting.
Yeah.
In terms of understanding what's under the hood.
Yeah, absolutely. Absolutely.
I mean, do you know that we can actually do neurotransmitter testing as clinicians? And nobody does this.
No, I didn't know we could do that.
You yourself can order neurotransmitter testing for your clients for $200, $300. and actually understand where are they in terms of their neurotransmitter function. And sometimes you can work with a lab that actually they will analyze it for the client, and then they will recommend whatever the client needs to balance out those levels. It's still not the full answer, because the full answer is still trying to understand, like, so what is underneath PANS. So you have infections, you have whether it's viral or bacterial infections, whether it's whether you have Epstein-Barr virus, whether you have influenza, whether you have strep throat, whether you have Lyme disease and all the co-infections. One big one, in my opinion, is Bartonella, because it really affects all of these OCD and rage episodes. But you have infections is one. I have a chart, and I'll put it to in my Facebook, that has 3 circles. And one talks about the elements of infections. The other one talks about toxicity in general, whether it's mold, whether it's pesticides, whether it's plastics. I mean, we live in a very toxic world that maybe they don't affect one kid, but they affect the other child. Even medications are toxins that the body has to process. And if your body cannot process, cannot detox, which is one of the primary issues with these children, then they're going to be more toxic. And as a result of that, their brain is going to be more overloaded with toxins. And of course, there's the big piece of the immune system. So the immune system gets attacked by these viruses or infections or toxic loads, and then it almost shuts down. And instead, I mean, in the world of autoimmune disorders, which we're going to see more and more of those, and we already have more and more than we had 20 years ago, then they're, like, for instance, I'll use myself as an example. I have Hashimoto's disease, which is a thyroid autoimmune disorder. And that is basically my body, instead of helping me fight, is fighting against my own body. Now, there's theories there whether trauma plays a role in all of these autoimmune conditions. And actually, there's a lady in Florida that's starting a new movement with EMDR in terms of resetting the autoimmune conditions, because we have so many. And I would love to see that this is indeed an answer to some of these problems. But it's an autoimmune that is compromised, whether it's because of illness, whether it's because of toxins, for whatever has been given to us genetically. So all of those elements is that autoimmune is not strong enough to fight these things. So you have children that are sick on a regular basis. They get this, and then they get this, and they get this, because their immune system, the immune system is supposed to help you fight whatever comes along. And in this case, is not only not ready to fight, but it's fighting against you.
Yeah, I want to the visual that you're painting here, and the description helps me appreciate what your daughter wanted us to understand even more. So if the body is basically under attack, and the immune system can't do its job, and the result is that the brain is inflamed, and therefore there are symptoms and behaviors that are happening because the body is just inflamed and under attack. It makes so much sense that there would be a helpless quality attached to it of my body is almost hijacked. I can't control my body. My body's hijacked in this overactive response. So I just want to bring her voice back in of just how true that must be. Yeah.
Yeah, and in the field of PANS and PANDAS, we call that a flare, because all of a sudden there's a brain inflammation, and it brings back this flare of behavioral issues. I want to also, for me, and this is my perspective as a therapist, we all have our own perspectives, but this is my interpretation and my perspective. I want to emphasize that for me, this is not a neuropsychiatric condition. This is a medical condition that brings neuropsychiatric symptoms.
Yes.
Because as a therapist, I am ashamed that we have failed children. All of these kids that have been diagnosed with schizophrenia that are in psychiatric institutions, the cutters, the ones that have big explosions, I feel like we have treated the symptoms. We never understood what was under the hood, which probably was a variety of infections and toxic loads. And that's where I feel like in our field, as we continue to grow and have more understanding of brain health and gut health, and also how do we change our field? Like, I mean, you've done an incredible job in terms of teaching lots of therapists about how do we think from a neuropsychological perspective. So when we have a child in therapy, how do we try to change that brain rather than just do therapy with no intention? I mean, I think in therapy, we always have impacted the brain, but we had no idea how we did it or why we did it. I think nowadays, with all the research that we have out there with polyvagal theory and like synergetic play therapy, I think we have a much better understanding of how can we be intentional, because we should be intentional. I mean, a neurosurgeon doesn't go and do therapy. I used to tell this to my students. I said, if you're going for surgery, do you want to go to the surgeon that has a plan of how they're going to do the surgery and understands the process? Or do you want to go to the one that's going to open you up and say, oh, let me see, let's figure it out and go with the flow of things here? No, I'm not going to the let's figure it out here. I'm going to go to the one that has a plan and an intention for how to. And I said, and mental health is serious. So how can we not be more intentional about it? Because I love building relationships, and I think it's critical to build relationships in therapy. But I think we need more than just building relationships. We need a map, a map that is scientifically based, that we understand, okay, and by the way, the same way that when somebody doesn't feel healthy, goes to the doctor and they do some blood work, why can we not do that as clinicians? Why can we not look at what are the critical elements that impact mental health and be more open-minded? Or another big one, and you and I could talk about this for another whole day, diet, the impact of diet on your brain, particularly with children. So,
Yes,
anyway.
absolutely. Well, you're really talking about the therapist's ability to take a holistic approach and to really look
Absolutely.
that there are multiple influences that are going on, and that if we're not open to a holistic perspective, the probability of missing something or misunderstanding something at minimum is pretty high. So I have a question for you regarding some symptoms that are often connected with
Mhm.
pandas. So will you talk about OCD and eating challenges? Because oftentimes people connect the two.
Yes, so there's a whole list, and I can mention them in a minute, of symptoms that we will see associated with PANS and PANDAS. But the for someone to meet the criteria, and when I do my presentations on PANS and PANDAS to therapists, I even give them the flow chart that doctors use, because in the medical system, they basically, the way they go is like, okay, let's look at this and rule it out. And if this isn't it, let's go here and rule it out. So it's not that they look at everything together in one sitting, particularly traditional medicine. If you go to a functional medicine doctor, they will be looking at different things. But we know that one of the major triggers for PANS and PANDAS is OCD, obsessive compulsive disorder. For me, I have actually had to redefine what OCD looks like, because we all know what OCD is. And however, in PANS and PANDAS, things that are like, if my daughter lines up all the little cars when she's playing, I can see, and she's stuck in this cycle that she cannot break through playing and organizing them in a specific way, it's very clear to me that that's an OCD issue. However, I have had to really understand, like when my kid, for instance, is taking a bath and she has to mix all of these different products and gets really stuck there, which many times I really question how much of those products really also add to her toxic load. So is she reacting because she's having this OCD, or because now we've added toxicity to the picture? And there's no stopping. There's nothing rational. There's no stopping. That becomes an OCD episode. And when you have an OCD episode, you're going to have more stress in your body. So therefore, your brain is less accessible, and that's going to lead you most of the times into a flare. And as a parent, and I think the important piece is that when she reacts, I have to be very much in tune. How am I reacting? Is she reacting and then I escalate because she's reacting, and then I'm triggering her and she triggers me? And how do I facilitate some sort of core regulation during a time that what she's doing makes no sense? So OCD is one. The other one is restrictive eating. For some, it may manifest as anorexia or bulimic, but for some, it's not that. Like, my daughter gets very OCD-ish about having to cook things, having to chop things, and then many times cooking things that she has no intention in eating, but she has to create it. But then when it comes to eating, she has really limited her intake in the sense of what she may. So today I made like pasta with a tomato base, and tomorrow is like, this is gross, disgusting, I can't even think of eating it. So that's what I mean about the restrictive eating. Is not so much that she's not eating, is her choice has become much more limited. And I think almost kind of like a child who has autism, which we know that food becomes more of an issue with those kids. I mean, the variety of foods, the texture of foods, because I think Pans and Pandas really brings up that sensory processing disorder for the majority of our kids too.
So I have an interesting question.
Mhm.
So, and my guess is that you would say it's not a this or a this, but when you think about the OCD components, and you think about the eating restriction components, are you from the position that they are more of a symptom of, or that it is a component that's there and then can be a trigger for? Does that make sense?
Yeah, I do think it's a symptom. I think it's symptom of the
I
infections.
think it's a symptom of the infection. I think that's important for listeners to understand that that yes, that it's a symptom of the infection.
Lyme disease, for instance,
Yes.
really affects a lot of those symptoms. And actually, if we start really digging, many of the, and I wanted to point this out, adults can have PANS and PANDAS. This is not just children. I mean, we somehow have this irrational thinking that when a child turns 18, poof, illnesses disappear. Maybe they change because of hormones a little bit. I'm not saying they don't, but there's plenty of adults that walk out there that have PANS and PANDAS because they have Lyme disease or they have mold or a variety of other infections. I think it's Lyme disease is even in many cases we have people who have been diagnosed with dementia or with Alzheimer's, that realistically what they have is either a toxic brain or they have Alzheimer's. And Dr. Daniel Amen, one of the holistic psychiatrists, he's the one behind all the brain mapping in the United States that was so popular, although expensive for some folks to really do it.
Yeah.
He talks about it.
Yeah.
Mm-hmm.
So let's then talk about, so we're saying those are symptoms. Let's talk about trauma response. So let's paint that picture a little bit more so play therapists can also understand what could it look like.
I do want to talk about that, but can I add a couple more symptoms because I want them to understand aggression, rage for many kids, and I'm not talking about anger, I'm talking about rage.
Yeah.
Anxiety, separation anxiety, like parents that will talk about, for the last 2.5 years, my child has not let me be alone in one room. Sleep issues, regression in school, math and reading, but also I've also seen it in drawings of really going from like being able to draw a picture a horse to going to back to stick figures. For some, it has been language. But the symptom list, for some it's tics, neurological tics. For some it's seizures. There's a wide variety of symptoms that can be going on under the PANS and PANDAS category. I think to some extent at the beginning, I didn't really even understand why did I focus so much on the OCD and the food when, like, for instance, rage can be such an issue. Yep. Or the fact that the child now is no longer functioning at a third grade level, but they're functioning at a first grade level because they have regressed so much, and certainly sensory, as I spoke before. So I just wanted to add that piece. So the trauma piece, I think the trauma is huge at different levels. As a parent, you feel traumatized because your child is lashing out in a way that you don't know how to control it. Parents sometimes don't know what to do, or they are afraid of sharing what's going on. There's a great level of shame, because if I tell my friend that my child just literally hit me, what will they think of me? Will they think I'm a bad parent? I think there's a lot of blame sometimes, like, oh, it's the relationship that you have with your child. You don't know how to parent your child, and that's why they act out like this with you. Particularly if, so some children will act out at home, some children will act out at school, some children will act out both places. But the reality is that they may have an ability to regulate themselves in some settings or with some people that they don't have with others. So there's quite a bit criticism for parents. I mean, I almost want to write a book about, because this really inflames me as a therapist. No, I should not be hitting my child when my child is hitting me because of a neurological condition that they have that affects their brain. That's not the answer. Me hitting another child is not the answer. Whether you believe that your religious beliefs tell you to do that, or whether it's your belief as a parent tells you to do that because that's what you learned from your own parents. No, we shouldn't be physically hitting anybody, because we know from a neuroscience perspective that that doesn't help any brain. It causes more damage to anybody's brain. It's like if I have autism or if I have diabetes, nobody would say, well, go and hit her because she's acting out because of her own medical issues. Nobody would say that. So why would that be different with a child that has a neuropsychiatric condition? Yeah. It's never okay to hit anybody. I mean, and it still amazes me that in 2024, we are prescribing this as a form of parenting. Anyway, I think we need to continue to understand how do we treat these infections or this toxicity, which of course we can do as therapists, but how do we find people that can help these parents? Because these parents spend 10 to 15 doctor's visits before they find somebody that can help them. I mean, they've been down this road, they're exhausted. It really affects marriages. It really affects relationships. You lose friends over this. Because if you're my friend and you tell me that I should hit my child, and I feel like that's not the answer to this problem, then I'm not going to come to you to share my pain. So I think it's traumatic that people don't understand, they judge. The child obviously is experiencing some trauma, because afterwards, like my daughter will say to me, well, after I come out of the flare, I feel so horrible about myself because how could I do what I did? So once she regains some awareness, there's this level of shame of who am I? And I hate myself for being this way, when in reality is something that takes over her brain or her body, like she explains. Some of these parents, Lisa, and I can't even comprehend this, they have 2 and 3 kids that have PANS and PANDAS. I mean, I can't even imagine how difficult that would be for a parent or 2 parents to manage. I mean, some of these treatments, particularly if you're leaving the traditional medical route, which doesn't always have answers, are very costly. I mean, so there is that financial piece because parents are extremely devoted to really helping their children. So you have families that they have lost everything trying to help on kids. But it's like being in a war, but it's in your own house. Your house is supposed to feel safe.
Yeah.
So it's almost, there's always trauma going on at home.
I'm guessing that there are some individuals as they're hearing this that are wondering, is PANS and PANDAS something that you have for life? Do people heal from PANS and PANDAS?
Some do,
Some
some
do.
do. And I think that the issue is that not every child is going to have the same presentation. They're not going to have the same issues under the hood. Some do, and there's a variety of treatments out there. I think the medical field has made some strides, but we're not there yet. There's tons of medical doctors that don't know what PANDAS is or don't believe in it. The testing is not always accurate. For instance, if you have somebody who has Lyme underneath, traditional testing for Lyme is extremely inaccurate in traditional medicine. So then you have to be with a provider that knows how to treat Lyme, knows how to treat mold toxicity, or really find out about all other infections. And there's different paths towards healing. And I think there's also, we want to see progress as a straight line. And you know that in therapy, progress is never a straight line. It's like hiking a mountain where you're going to have different levels and different challenges along the way. And that's a little bit of how PANS and PANDAS is too. You may do 2 steps forward, 1 step backwards, 3 steps forwards. So it's a process, but it is a long process. And it is difficult to feel like, I wish there was one modality that we could use that would say, okay, this is it. We do this, and then things change.
Well, correct me if I'm wrong, but I'm hearing a couple things that I want to reflect back, because the picture that I feel like I'm getting here is that there is a biological component that needs to be addressed. There's a physical component, a biological component, a medical component, if you want to say it, that does need to be addressed.
Yes.
For us as play therapists, we can't necessarily address that component of it. However, the child may need some support with loving themselves or appreciating who they are and the shame and guilt that they might be carrying or the frustration about what's happening to them. I'm hearing parent-child work. I'm hearing family work. I'm hearing supportive care for the relationship amongst each other, within themselves, and I'm hearing that as a core component. Am I hearing that accurately?
Absolutely. You just pull it all together. And absolutely, those all are needed. I think as play therapists, we do owe it to our clients that we need to educate them. Even if we're not the doctors, we can educate them about what this is. There's plenty of videos out there. There's plenty of organizations, like one of my favorite organizations is Aspire Care, which they are devoted to helping PANS and PANDAS parents with education, schools, communities, so we can guide them to have a better, there's Facebook groups that they would have emotional support, that they can find resources, and certainly that I can bring that information as a therapist and say, okay, I want to introduce this condition to you and explain to you what it is. So rather than a parent has to take 3 years of researching on their own, because the therapist didn't know what PANS and PANDAS was in the first place. And then hopefully, like you would send like if you have a child who you think they may be anemic and you have to send them to a doctor, have a list of providers, which by the way, Aspire does provide that by state to the client, so they could go to the right provider who has an understanding hands and pads, and at least they can start on a good foot. But I mean, lately I've seen some folks talk that if they do see a child, they will never see the parent. And I mean, I want to pull my hair because I'm a marriage and family therapist. I'm like, how could you do that? How could you work with a child and not work with a parent? Well, in this case, even more so. I think, how can you not work with a parent? If I'm coming to you, I have so much, if I'm bringing my child to you, I have so much to also work personally as a parent, as a mother, that to leave me out of that equation, it would not be helpful to my child in any way, because we need to work on that. How do I help my child regulate in this situation? Am I the one that is actually dysregulating her at times? I'm sure I am. So I need to gain awareness about that too. But yeah, the family itself, the relationships, how this, if you have other children, how it impacts the other children in the picture, the trauma piece, how do we all reprocess this trauma? How do we look at the shame and guilt? It's exhausting too. So can we have resources to add that can help the child and the family? But I think the therapist can play a very critical role there.
I'm just thinking, if we've got listeners thinking, yeah, but what if I'm just guessing or this and that? And I just had the thought, we all have our intake paperwork. And I think very few, I'm going to take a guess on this, but my guess is very few play therapist paperwork has a comprehensive medical section. Usually it's just a couple little questions, or it's I don't know. I haven't seen extensive ones, but I just had the thought of, what if we included some other questions in our intake paperwork that had to do, or our forms on questions that sort of illuminated eating issues, gut issues, OCD tendencies, sleep issues, rage responses, exposures to mold, exposure, like what if, like just what if, and if there were enough markers in there, then it could help us say, let me keep this on the radar, at least as a possibility as we're pulling all this together. Do you see robust intake forms?
No, because Lisa, you have to remember, our counseling programs do not train people to work with children. I mean, you don't have to take a child psychology class in any counseling program out there. I mean, it is only those who actually take play therapy, or those who work in school systems, that will take some child counseling class. But there's a lot of therapists that work with children and have no understanding how to work with children. I know we haven't been taught about integrating medical issues and the relationship between medical and mind related issues. Certainly the holistic approach that you and I are talking about. I mean, what about asking, tell me about, has your child had strep?
Yeah. How
in
often
the last 5 years? How many times?
Yeah, exactly. How often does your child get sick? Does your child
Well,
recover easily from illness?
has your child, for instance, had a load of antibiotics, which of course we know that destroys the gut? Also, the other piece, and I learned this when I was doing my trauma TBRI work, we don't even ask about pregnancy and how critical pregnancy is to the health of a baby. I mean, if the mother was sick herself, or was living under extreme stress levels for whatever issue it is, or was taking a variety of medications, antibiotics, of course that impacted the utero. If the mom is struggling with poverty, domestic violence during pregnancy, of course that impacted the baby in the utero. I mean, all of those things I think are very important to understanding a nervous system that is dysregulated. And that's another critical piece to take to therapy. A nervous system that is dysregulated. And I know your work, there's tons of work in terms of regulation and co-regulation. But so how can we in therapy, so we're not doctors, we're not nutritionists. Oh, and I will add to your intake form, how many of us ask about diet and nutrition? Like a question like, tell me about what you eat on a regular day, from the minute you get up till the minute that you go to bed. Alfred Adler used to do that with, tell me about what happens in your life. Well, tell me about what you eat, because that itself gives me a load of information about what is this child eating. Are they primarily consuming sugar? Which, by the way, I heard the other day that sugar is more addictive than heroin.
Yes.
And then we also have all
And
the
and supports inflammation in the body and the brain, because the body, the viruses, they feed it, they feed off of it. It supports the multiplication of what's
sure,
going on.
and it
Yep.
also increases candida infection in your gut, which of course it also affects your brain, and it's very addictive. And also mold impacts candida, which also increases sugar consumption. But I mean, in this country, and I'm going to use this country because I was not born in this country, we actually allow things in food that are illegal in other countries. For instance, food coloring, which most of children's foods have the red 40 and the blue and the green and the yellow. All of those are neurotoxins to your brain. Why are we putting those in foods that children eat that will affect their brain? I mean, how often do teachers give M&Ms as rewards, or donuts or cupcakes with all of the icing coloring? We're part of a community that also propagates disease in many ways, or not healthy habits. But yes, all of that.
Yes. So Montse, two last pieces here as we find a stopping point. One is, if listeners want to find you, they want to learn more, they want to learn from you, they want to, you said you're going to have a handout that's available on your Facebook page.
Yeah.
You go ahead and share with our listeners where they can find you.
Sure. So they can find me on Facebook under Montserrat Casado. And there, my other group is Resiliency Coping, which is my practice. I post there. I post in a lot of the play therapy groups, the play therapy community, and other groups. I tend to do these webinars for therapists like once a month. And I don't do them because I'm making money out of this. I do them because I want therapists to help children. And that's part of my my passion is, how can I train more people that when a child and a parent go to see this therapist, they actually know what this is. They don't have to be a guru in Pens and Pandas, but they will not say, I'm going to recommend you to see a psychiatrist and get medication and get your child diagnosed with schizophrenia because they had hallucinations. Because to me, that's missing the boat. That's not looking under the hood to figure out why are they having hallucinations.
Yeah, thank you. So the final question, I know we've covered a lot of pieces. I know there's more. What do you feel like is there something you haven't said yet that you really want us to know and understand as a final piece for today?
I think you highlighted that piece, and I think it needs to be. I think we as therapists need to continue to learn more. I listened to one of your podcasts last week about comfortably doing uncomfortable things. And I know it was related to therapy, and I really relate with that perspective as a therapist. But I think as therapists, we also have to also comfortably do uncomfortable things, which is recognize, I don't know about this, but I owe it to my clients to learn about this. I think it's the ethical thing. I mean, we went to see the physician with my daughter, who's a new physician, a month and a half ago, and she will very openly disclose that she doesn't really know about pandas or how to treat pandas. And I'll tell you what my daughter told me after we left the office. She says, why doesn't she learn about pens and pandas? Because I have pens and pandas. And I said, that's the ethical thing to do. When you have a client that comes to you with something you don't know anything about, you go and learn. It's a great opportunity for learning, for becoming a better provider, whatever you are, medical therapist, occupational therapist. I mean, in this field, as you know, we're always learning. We never are going to reach a point that says, oh, I got it all done. I'm done. I don't need to learn anything else.
Yeah.
No, that's not. We continue to become better at what we're doing. Like, I am not the therapist I was 10 years ago, and I owe it to my child and to this Pans and Pandas. I'm a very different therapist nowadays.
I want to say thank you so much. Will you please thank your daughter for all of us and for all the kids that she is going to help as a result of sharing her?
And that's one area we do need more, Lisa. We need groups for these kids. So they have a voice, so they're seen, they're heard, they're validated in the midst of their nightmare struggle. Yeah.
Thank you for sharing your journey with us. Thank you for your dedication to play therapists, for educating us. I know you educate in more topics than just pans and pandas, but thank you for being out there and helping so many people. I want to say just
Thank you, Lisa. Appreciate your
an honor
desire.
to spend this time with you.
Thank you.
Listeners, if you don't know about pans and pandas, there's your call to action. Go learn, go read, listen to this podcast again, keep this on your radar, and wherever you are in the world, take care of yourselves. You are the most important toy in the playroom. Until next time.